The risk factors include valve problem when the heart grow old and the valve develop problem themselves. We have mechanical valve, which is being placed in the heart to assist the functioning of the valve when there is an incompetent valve. We have prosthetic valve that they insert to help the heart valve to regulate flow of blood. We have people who uses intravenous drug as a major risk factor. We have infectious gum as a result of poor oral care. And then we have colon cancer. Now look at the pathophysiology of endocarditis. For endocarditis to be ensued, there must be two factors that you have to know as a nurse: the presence of bacteria in the blood, or there's abnormality of the endocardium, which will facilitate their adherence and growth. In whichever way, you must understand that endocarditis may ensue. We will take into details how bacterial endocarditis is formed. But before then, you must know that bacterial endocarditis is caused by gram-positive bacteria called Staphylococcus aureus and Staphylococcus. These two bacteria we mentioned earlier are normal bacteria that live on our skin or in our GI. They, however, harmless. But however, when there is a disruption in the integrity of the skin mucosa, they enter into the bloodstream and find their way into the heart valves. Some of the conditions that compromises our skin integrity include cellulitis or abscess, gum infection as a result of poor oral care. We have colon cancer. Intravenous drug uses serve as a gateway for this bacteria to enter into the blood. Now that you have understanding how the bacteria enters into the blood, let's now look at the other side where there is endothelial abnormality facilitating the growth of endocarditis. When there is a valve abnormality or artificial valve, the blood flow through the heart becomes chaotic. This causes the blood to wear and tear to the heart endothelium. When there is an injured site happening, there is an aggregation of platelets and fibrin at the place where the injured site occurred, and this forms non-bacterial thromboendocarditis. Non-bacterial thrombotic endocarditis can be seen as a deposition of sterile thromboid on the cardiac valve due to hypercoagulability state, as in the example of chronic DIC, or adenocarcinoma, where we have increasing circulating mucin. But you have to know that this endocarditis, that is the non-thrombotic, is not disruptive. Another form of endocarditis is a Lippmann sac. For example, systematic lupus erythematosus, which is an autoimmune process, causes a sterile vegetation that can be seen on heart valves as a result of immune complex deposition and inflammatory reaction. So, having known how non-bacterial endocarditis is formed, let's look at how bacterial endocarditis is ensued. When the skin integrity is being compromised and the bacteria find their way into our bloodstream, we call it bacteremia. That is the presence of bacteria in the blood. We must understand that bacteremia does not alone cause effective endocarditis because the heart pericardium is made up of smooth muscles which prevent the bacteria from entering the heart valves. But rather, when there is a damage, it makes it easy for endocarditis to happen. Non-bacterial deliver organisms such as Staphylococcus aureus into the heart's surface. Bacteria have ability to form a biofilm which is sticky and also coat. This sticky coating made up of proteins and sugar to enable these bacteria to protect themselves from immune system and allow them to stick together to the already formed non-bacterial thromboendocarditis causing a vegetation. We mention of biofilms. Biofilms occurs in an area of low pressure. For example, low pressure arterial surface in the aortic regurgitation. This is what is called endocarditis. Biofilms formed over time gradually destroy the heart valves, leading to heart failure. This vegetation is soft and bushy, so part of it break off and end up in the bloodstream. This metastasis to brain, liver, kidney, bone, skin, and spinal cord. Let's now look at the clinical presentation of endocarditis. We talk about inflammation. So, inflammation will result on unexplained and prolonged fever. There will be sepsis, which can be from unknown region and triggered by skin infection. Because there is a heart valve abnormality and a chaotic manner of the blood flow, you may hear a heart murmur. When the thrombotic is formed and bacteria have been able to colonize the area, the vegetation form a septic emboli, which normally find themselves in the blood vessels, the hand, the feet, the conjunctiva sclera, among the rest. When they are found under the hand, we call it ocular nodes and genuine lesions. We have sphincter hemorrhages, dark red linen lesions in the blood, in the nail bed. We have petechia, we have rot spots, we have persistent pain at the lower back. The psoas muscles is being affected. The abscesses, CNS, liver, spleen, kidney, and psoas. Other clinical manifestation that you must know is night sweat, anorexia, headache, malaise, cough, and joint pains. As a nurse, you must know the clinical manifestation and you must know the clinical findings. So when a blood sample is taken and it's run for full blood count, you have to look for anemia and leukocytosis. The ESR and the C-reactive protein will increase. Because there is the position of the septic emboli in the kidney, urinalysis will look for proteinuria and hematuria. Endocarditis is one of the serious complications or serious sickness that affects the whole body. Echocardiogram can be used to detect the presence of vegetation on the heart valve. We can use the CT scan, MRI, X-ray to also detect the possible abscess in the brain, the lungs, or the spleen.